Good afternoon. This is Dr. Romero Salinas at Lincoln University. I am Extension State Specialist. And with us is Dr. Jamie Stewart. That is our key speaker for all these certificates. She knows a lot about reproduction. So we are happy to have you here, doctor. And also with us is Dr. Mohan Acharya, that is also Extension State Specialist here. So please go ahead with your talk, Dr. Stewart.
Okay, well, thank you again for having me back and for everybody who is logged in. This will be the last of the talks that I'm giving. So I really appreciate all the people that have been following us around and asking great questions along the way. So this talk is going to focus more on testicular measurements using ultrasonography and fertility assessment. So some of the more advanced procedures that I touched upon a little bit when I was talking about the breeding management of bucks. And I was just going to go in more depth of some of these techniques and what the research has told us and is currently still telling us about how we can use these in our fertility assessments. So at the end of today's seminar, I hope that you all will understand the importance of monitoring testicular size and using palpation for feeling consistency and symmetry of the testicles, knowing how ultrasonography can be used to diagnose certain disorders and predict fertility in rams and bucks, and then to be familiar with different sperm quality assessments and how they are used to predict fertility. And so I showed this slide once before, but just reiterating of why do we care about testicular size? And that's because testicular size itself is directly related to sperm production and quality. So over here on the left, you can see the entire ruminant testicle, and the ductus deferens, or what you might know as the vas deferens, is where the sperm essentially exits the body. And that's going to eventually connect with the penis for during ejaculation. And then kind of coming down the ductus deferens is here is the tail of the epididymis, and that's where sperm is usually stored right before ejaculation occurs. And then we've got the body of the epididymis, and then the head of the epididymis is right here, and that's kind of another spot. All of this epididymis area is where the sperm is going to do its final maturation. So the sperm's usually fully functional. It's just got to mature as it goes through here until it's stored in the tail of the epididymis. And we talk about this because especially the tail of the epididymis is a really common spot where pathology can occur in the small ruminants especially. And then the head of the epididymis, we talked a little bit about the pulled intersex condition. This is typically where we would see things or where we would feel things like sperm granulomas. And and so this is where it connects directly with the testicle. And then within the testicle, you've got all these little areas called seminiferous tubules. So you can see these little compartments blown up over here. And within each seminiferous tubule, that's where sperm is actually being produced. So the more seminiferous tubules you have, or the more volume of seminiferous tubules, the more sperm production quality there is. So if you've got bigger testicles, it means you've got more of these. And this is what it looks like when you take a slice of it and put it on the microscope. This is what all of these little things look like in cross section. And so we start with the sperm. They start as these circular structures, and then as they develop, they turn into, start to see them elongate here before they get released into the lumen here, and then that's where it comes out here into the rete tubules, and that's where it eventually goes to the epididymis. So the more of these little circular things that you see in there, the more sperm they're going to be able to produce. But also, there's an important cell within the sperm structure, and it's called the Leydig cell. It's showing it over here. It's usually kind of around the outside of these areas. Those are what produce testosterone, and the testosterone is important for maintaining the sperm quality. So it directly functions to promote spermatogenesis, but it also promotes male behavior and a lot of other good things for reproduction. So again, when you have a higher volume of testicular tissue, you also have more Leydig cells. So the testosterone production seems to be increased, and that helps with the quality of the sperm. So not just how much sperm there are, but making sure that they're of good quality and able to promote fertilization. And so, kind of the gold standard, what we would think of to measure our testicles would be using calipers. And so, this is just kind of a standard caliper that you could get, at any kind of hardware store. And you can actually calculate the testicular volume by acquiring the width and the length of the testicles here. And you can either double the width and you assume that the testicle is kind of the same, or you can actually go along the other side, so kind of in the z-axis here, and you can measure the depth of the testicle as well. But most people will just double the width and then times it by the length, and then there's a little formula to account for this being like a spherical type structure, and that will give you and you do that for each testicle, and then add those two testicles together, and that gives you your total testicular volume. And that would be the gold standard. That's what they do in stallions when you can't get a scrotal circumference for obtaining volume. But luckily, with our ruminants that have this pendulous scrotum, we have the ability to do a much easier measurement, which is called the scrotal circumference. And I've talked about this before. It's where you take the scrotal tape and you go around the entire testicle, and then you crimp it just enough, like so that you make sure that you're not leaving any gaps in between the tape and the testicle, and then you're measuring what the circumference of that entire testicular tissue is. And there have been many, many studies that have found that the scrotal circumference is positively associated with testicular volume, and that scrotal circumference because of that, also has a positive association with both sperm quality and output. So rather than having to do these kind of intense measurements with calipers and do a bunch of calculations, we can get one easy measurement and still get the desired outcome. And then I mentioned also that it is worth noting that there are going to be a lot of variations between species, breeds, and even individual animals. And within animals, there'll be variations throughout the year. I mentioned in the previous talk that we can see up to a 30% decrease in the testicle size outside of the breeding season, and it won't necessarily affect their ability to breed once they come back into season. It makes them a little bit less fertile if you're trying to do out of season breeding, which is why we usually recommend not trying to breed quite as many females out of season. And just kind of a couple little cases that I had from cervid cases, just to kind of show the point of why size matters. So these I used to do some white-tailed deer work, and we would have people that if they had one that died suddenly, they would and you might have done this with any of your males. If you have one die suddenly, you can actually send the testicles in as long as you can get it to a place within 24 hours, and we can actually cut off the tail of the epididymis, flush the sperm out of it, and freeze it. So I would get this not infrequently with deer when I was at U of I, and as a resident. And there were several cases, or there were two cases that I can remember that they were just very small testicles, and there was no I couldn't find any data on, it's so small I shouldn't even attempt to flush it or anything like that. And you can see this one I already cut the tail off. But so, so one was a white-tailed deer, one was a mule deer, and then this is just kind of a normal one that I had that I was able to actually freeze semen on. And so basically, I went through and I did measurements of what the volume of the testicular tissue I had for these testicles were. So in both all of them, I was able to get a left and right testicle to use. And then I actually I'll tell you what I got on the semen results too, but I'll go through the histology because once I was done flushing them, I went through and did histology, fixed and did histology on these testicles. And again, these are those seminiferous tubules that we saw. And you can see in this image, this is our normal one. So you're seeing quite a few. This little gap in between is just it's just a artifact from the fixation process, so it's not actually abnormal. But there's quite another number of these. You can see a lot of the circular structures. So those are again those are the sperm cells when they're immature. And then as you get to the middle, you can start to see a lot of these elongated ones. So one of those, the first one that I saw that were small from the white-tailed deer, you can see not as well described of circles in here, and very few kind of elongated sperm in here. And then over in this little mule deer one, I couldn't find any, again, even fewer of the little seminiferous tubules in there. And then in the ones that I could find, I'm only seeing the immature sperm, so these little circular areas. So they weren't even completing the process of spermatogenesis to become elongated. And then here's just showing those kind of up close. So again, you can see all these elongations right here. So these are all normal sperm production, all the immature ones, which are basically the pool that it picks from. Over here, you're seeing not quite as many of the mature ones, and not even as many of like the pool to pick from. And then over here in this mule deer, like I said, you're seeing a lot of the immature ones, and you're not seeing any of them that get to that elongation phase, which is the final part of spermatogenesis. And this is just a different type of stain that actually the blue shows, the pink is cytoplasm, and that's normal, and the blue shows collagen, which is not normal. So you can see there's a lot more of that blue structure in these two really small ones. So we're not, cytoplasm means that's kind of like the normal structure stuff that we would see in the seminiferous tubules. So again, more of the pink over here and then more of the blue in these abnormal ones, showing that there's just not as much testicular sperm producing or testosterone producing cells in there. Okay, so at this point, I have a poll question to start us off.
Okay, let me go to the polls. Question one is over there. I think most of the people is ready.
All right, so
Okay.
majority of you did very good job. Testicular size is positively associated with sperm quality and output. Let's see, the one males with small testicles produce more testosterone and will have greater libido. So that would actually be opposite. So larger ones, we would expect to have more testosterone and probably a variable effect on libido. And then the males with the larger scrotal circumference will always pass their breeding soundness exam. So that's not always true. There can be other factors involved. And then obviously the testicular size has no impact on fertility. Obviously, that's not true. Otherwise, we wouldn't be here today talking about this. Okay. Okay. So then I guess kind of I'm just gonna go back here. So basically what all of this told us here about the sperm quality is that this one I was able to flush, got normal looking sperm and a normal looking volume, and that was an output, and that was all great. So that's kind of normal. Over here in this guy, what we found was that he was undergoing some testicular degeneration. So at some point, we don't know the history on these guys or how old they are. But at some point, it seems like he might have had normal testicles, and either he got ill or he was older, and something was causing those testicles to go down in size, and it was affecting his quality of sperm. And then in this one over here, we were expecting that he's probably never had normal sperm, and so because he's just showing a lot of immaturity here. And when we collected, so this one there was some sperm when I flushed it, but just not even enough to freeze. And then this one, when I flushed it, all I found were these immature spheroid type cells. So there was not even any normal sperm. So he likely had just never developed his testicles normally. And so that was kind of the outcome of what these cases were. And again, going along with the fact of if we, looked at differing sizes of the testicles, it could have saved me from having to flush those because I would have known we're probably not going to get anything if we go off of a minimum size. So, but I did learn a lot from it, so it's not all bad. Okay, moving on to talking a little bit more about testicular ultrasonography. So it's not usually a part of a routine breeding soundness examination, but it can be used to aid in diagnosis of reproductive disorders in the male, or if you have if we had a male that not passing his breeding soundness exam and we want to dig a little bit deeper into why and make sure that there's nothing else that we can't find. And then I'm going to talk a little bit about some studies that have been ongoing, some of which I'm doing and some with which other people are doing that show what the potential for predicting future fertility using ultrasonography is. And so one of the things is I mentioned using the calipers to get the testicular length and width, and the same thing can be achieved by with ultrasonography. So you can use your calipers, and it's probably a little bit more accurate because you can actually measure the testicular tissue itself. That you can, see the margins rather than guessing what's testicle and what's epididymis when you're kind of feeling it and trying to get those measurements. So it probably makes you a little bit more accurate. So this is right here is getting the width. So for this, we have our ultrasound probe placed this way, and you can measure from side to side. And then here, I've got the ultrasound probe kind of face down the bottom and shooting up. And from there, you can get the length. If it's small enough testicles, if it's not small enough, you might have to be a little more creative, but you can usually get the length measuring from about here to here. And so from that, you can do that testicular volume using that calculation I talked about. And the other thing that's I found interesting to look at in some of my past studies is looking at the shape of the testicles, especially how they change over time. Because in bulls, they found that regardless of the scrotal circumference, that the longer the testicles were, meaning that their width to length ratio was less than or equal to 0.5, if you took the width and divided it by the length. Um, Compared to the spherical ones. So, like your thinner, fatter ones didn't necessarily produce better sperm compared to the long ones, so long as they met the minimum scrotal circumference. And some of that probably has to do with if we went back and measured the volume of sperm being produced, but also what's causing them to have more of a spherical shape. And is there some dysregulation in the process um, met of thermatoregulation. So when the blood flow is going through and helping to regulate it, is there some disruption because of that? Or are they spherical because there's a lot of fat deposition? So we've talked about that last week with the body condition score. So there's a lot of other factors, and ultrasonography can be used to kind of help determine that. This is just what I was talking about with the bulls. And so a couple other things that you can pick up on ultrasound. So this was, I had a summer student that was ultrasounding a bunch of should have been healthy rams this summer, and she happened to come across a couple that had some abnormal structures in it. So this guy over here, this is his normal testicle right here, and you can actually see there's a little spot where he might be starting to get some degeneration. But then we come in and look at this side, and he actually had a pretty big abscess right here in the middle of his testicle, and his semen quality was actually passing. So this wasn't anything that was he was probably compensating by product. Either it was walled off not enough that it wasn't affecting the production on this side, or this side was compensating enough. So without ultrasound, we wouldn't have known that was even there. And I did actually go through and aspirate and culture it just to make sure it wasn't something like CL. Or brucella, and it actually was sterile and did not culture anything. So we don't know exactly what caused it. But I think the farm manager was going to go ahead and cull him, even though he was still passing his exam. But technically, something like that could have just continued to be monitored once we aspirated it. Oops. So over here is another one. So this guy did not pass his breeding soundness exam throughout the summer. He had several opportunities to. So here was his normal testicle. I can't remember if it was left or right. And then here was the abnormal one. So, and this is just this looks different from this view because it's a different view of the testicle, but this one showed kind of the best view of it. So this is where you can see the mediastinum running down here, whereas this one we're looking kind of right at the mediastinum. So it's just a different view there. And that's just kind of the central part of the testicle that's got connective tissue in it. And so again, this was a normal looking testicle. And then over on this side, he he just had some kind of abnormality there. And I did poke it and try to see there was no fluid in it. We did get a little bit of blood, so I don't know if that was just from the structure being very vascular or if it's a bloody filled pocket, but he was not passing, so he was on the coal list anyways. Just, something kind of weird that we can see it and say, well, the prognosis for that's not great, or if we wanted to, we could try to remove the abnormal one and see if he can compensate with the other one, but the ram was not genetically valuable enough to try that. And then here's another one where On palpation, I remember the students coming up and telling me, I think I mentioned this last time, about how one of the testicles was larger than the other, and come to find out, he actually two really small testicles and then two really large epididymis. And this was a sad story. The clients had he was a valuable buck, and the clients had just bought him a few or a few months ago, and then had put him out with the does. Noticed they weren't settling, so they did a semen evaluation on him, and noticed there was sperm at the time and the quality was pretty low. And so they scheduled an exam for him to come in for us to see him. And then so we did the exam, and by that time we weren't able to get any sperm at all to come out. And when you see this, where the tail of the epididymis is, it's all for both of them, all full of this purulent material. So it's probably clogging the outflow, and the testicles were completely, this is a testicle right here, very small and full of little hyperechoic nodules, and over here. So again, we know the prognosis. Seeing this, we can definitively say there was no way that this ram's going to get better, or buck. This one was a buck, and so it's hard to give that information, but it's useful to have that. Whereas you might just, palpate it and be like, well, there's an abnormality. We could try treating and see what happens. This can give us kind of a definitive closure. And unfortunately, we don't know how long he had been. Ended up being a CL, so we don't know how long he had had it. But I was probably guessing that it was from before when she got him. And then talking about our uses beyond just pathologies. So, looking at the future of male selection. So, some of the projects that I've been working on are with ram lambs that we've got at our ram test station. So, they undergo performance testing. So, we look at things like growth. And we've got two of them. At one of them, they look at parasite resistance. And so we spent a summer and we went out to do testicular ultrasonography on these guys. They're about 4 to 5 months when they get to the test center. And from that, we would take the images, and what we would do is I would use a program called Image J, and we would draw circles in very particular points, and we would average those. And what that does is it actually tells you how many white versus black pixels there are, and it gives us what we call echogenicity. So it tells us the degree of whiteness or blackness that's in there. And you can use that to basically, there's been studies that have shown how it relates to future sperm quality, because all the sperm that's in the testicle right now, we're not going to see for probably another 40 some days. So it's a good way for us to try to predict in the future. So as these guys are maturing, they're too young right now to do a BSE on, but what's their likelihood that they're going to pass their BSE? And then over here, we basically just put the probe up into the scrotal neck and looked at the testicular artery where the blood flow comes into the testicle, and we were measuring the blood flow into the testicle too. So that was another, using our Doppler function. And I do have some data on that I will show you, of what we found so far. And so with some of the other studies, so testicular echogenicity was positively associated with microstructure in the rams. So specifically, they've found that seminiferous tubule diameter and the presence of mature cells were associated with how bright it was. So, and then this is what they've found in bulls when they're measuring for maturity, is this was a pre-pubertal bull, and then this is a pubertal bull, so one that's already hit puberty, and you can see how much brighter it is. And that just means that the cells are becoming more functional in there. So we're obviously interested because ultrasound is a valuable animal side test. And even if we can't get the information right away, we can take it out into the field and get measurements. And hopefully one day there's going to be the technology that might be able to analyze it right then and there. But as of now, there might be technology for us to be able to use to take it back and analyze it and get some data within a reasonable time frame. And then the testicular blood flow I talked about, there's been a few studies that have looked at that found that some of the testicular blood flow in goats have been consistent with changes in the hormone concentrations, and more specifically testosterone. And they found that any alterations in the blood flow was moderately correlated with sperm quality. So they were finding some association with blood flow there. So again, because everything being produced in the sperm is not going to exit the body for another 45 days, this is all kind of a predictive type value, which can be of a lot of usefulness. And the other thing is looking at the thermal gradient. So I've talked about a lot about thermoregulation. So what we want is the testicles so close to the body here. Obviously, is going to be body temperature, but then as we get further, we should see about a 1 to 3 degrees Celsius decrease in the testicular, in what we call the scrotal skin temperature. So basically, what temperature we're seeing here. So this is what a normal one looks like as we see it kind of decrease as you go further down. And then over here, this is a buck that had epididymitis. So normal up here, and then as it goes down, it looks like it's following the right trend, but then you start to see it get warmer, and even right here in the affected epididymis, really warming up. So again, something that we might be able to use in assessing pathologies and trying to figure out prognoses for these, especially. So there's a lot of data here, but this is a paper we published last year from those rams at the test station. And we basically we did all these measurements, and then we basically categorized guys by the ones that were excellent on BSE classification. So they were kind of the best of the best, satisfactory, meaning they passed, but they weren't the best of the best. And they were questionable, meaning that they didn't pass right now, but we thought that they would pass in future ones. They probably need more time. And then the fails, which means that they were so bad that I don't think they're going to pass anymore. And we assessed them both in May when they first came in, and then we did another assessment in June just to get another time period. And the biggest thing we saw was that obviously scrotal circumference played a role. So you can see in both May and June, the ones that were excellent had the biggest scrotal circumference, and that was also associated with total testicular volume. So, similar to what other studies have shown. And then the other parameters, we didn't find any differences based on the ones that would pass or not pass their BSE, but we found changes over time. So as they were maturing, we found that the testicular ratio went from somewhere around this zero point 0.7 range, like 0.69 to 0.72 range, and the testicular ratio increased a little bit to this. So they actually got a little bit on the fatter side. Excuse me. Upwards to this zero point 0.8 range. And then the pixel intensity itself also increased um, from the like 650s to 60s up to the 70s to 80s. So they become more hyperechoic, which is as they matured, which is consistent with other species. And then the blood flow. So the thing to know about blood flow is as the resistive index and the pulsatility index go down, the blood flow goes up. So we did see increasing blood flow over time in all the categories. And then we did look at scrotal skin temperature too, and found similar trends. So, but we did see some differences with our excellence. So, and we looked at the gradient too. So that this was the scrotal skin temperature in the middle, and then we looked at how much it changed from the top to bottom. And we didn't find any changes with the gradient, but we did see some changes with the scrotal skin temperature based on whether they passed or not. So there's potentially some usefulness with that measurement that we'll need to look into a little bit more for predicting. And then this was kind of a follow-up study we did to that where we actually had some rams that were at the sheep barn, and we followed them throughout the year and just to see how these parameter change throughout the year. And this is one that actually we only had like two, I think, that were included in the first study and the second study. So this was him. So starting off, you can see like pretty bright, and then his actually we could see a little bit more mediastinum, and his echogenicity actually didn't change much between this would have been between June and August. And then actually, as we got deeper into season, it looked like the echogenicity went down a little bit and then continued to go down. And then as he was starting to enter his second breeding season, we could see it starting to go up again. So it's starting to get brighter. And these are the pixel intensity measurements that we got. So some interesting changes, because remembering that after their first breeding season, they're still growing and maturing. So there's a lot of different changes that could go on based on season and age of the animal. And so this is not published yet, but we're working on getting it so that published. I've just got some minor revisions to go through and then it'll be done. So again, the pixel intensity we found that in that first fall it was kind of at the lowest, and then as a group there were really no changes between the rest of them. So it kind of increased and then stayed about the same. And then looking at the blood flow, it actually started off, I'm remembering this is going to be opposite since these are the higher RI means the lower blood flow. So it started off low and then increased, and then it actually kind of decreased again going back into the season. So the same for both of these. So some interesting changes we weren't necessarily expecting. And then scrotal circumference, again, outside the season. We didn't really see much changes. Again, they're still growing. So we weren't too surprised by that. But coming back into the summer as they were getting ready to come back into season, you can see a moderately big growth. And then again, the ratio kind of changed along with that. So we could see that the ratio kind of lingered outside so this is within the fall of their first breeding season. And then it kind of stayed the same. And then it suddenly increased as the summer came. And then and compared to our other study, we did find the most interesting findings were with our scrotal skin temperature gradient. The scrotal skin temperature is hard to assess because with the different seasons, the ambient temperature changed. So obviously they were going to be lower when the weather was colder, versus in the fall and winter versus in the spring and summer when the temperature was warmer. But the gradient, we found some significant changes, especially in the winter, and then it decreased in the summer. So again, probably affected somewhat by um, how well they're thermoregulating with the changing temperatures. And then getting on into sperm quality. So we compared our pixel intensity with our sperm quality. So we found a negative association between pixel intensity and the percent of normal sperm, which means that the higher the pixel intensity, the lower the percent normal sperm, which is actually different than what we thought it should be. We thought there should be higher pixel intensity would be related to a higher percentage of normal sperm. And then scrotal circumference, higher the scrotal circumference was the higher percentage of normal. So that wasn't too surprising. And then it was the opposite for having head defects. So it seemed like pixel intensity of all of the head, midpiece, or tail defects. So this is the sperm head, right here is the midpiece, and these are the tails. We found the most association with pixel intensity and head defects. So it seems to definitely hone in on the presence of those most likely. And then we also looked at some changes with age and pixel intensity. So a negative association. So the older that they got, the lower the pixel intensity. And so that kind of fits with all the changes that we were seeing over time. And then over here, this is what I talk about with a head defect. I've got a few slides on this that I'll cover, but you can kind of see like whereas here the head is nice and normal, you can see there's kind of like a little divot in here. Here is a really common mid-piece defect. This is a proximal droplet. And then over here is a tail defect, so you can see a little curl on his tail there. And we did see, so again, these are our blood flow for the testicles. So we did see some association with the mid-piece defects. So it's technically, again, if we think of blood flow as being opposite of these, it's technically a negative correlation. So the higher the blood flow, the lower the percentage of mid-piece defects, which makes sense. If there's more blood flow, there should be less defects. So that was another interesting finding that the blood flow seems to be more associated with the mid-piece defects and pixel intensity seems to be more associated with the head defects. Okay, so I've got another poll question.
I go there. I got lost. Sorry.
There it is.
Or everybody is right or everybody is wrong.
All right, so yeah, it looks like everybody was pretty much right on track. So everything here is stuff that I talked about of ways we can use ultrasonography in ram and bucks. So better diagnose disorders that can impact male fertility, Doppler for assessing blood flow, which can be used to predict future fertility in males, and also the ultrasonography to assess the echo texture that I talked about. So great job.
Yeah. Please, for the everybody that haven't write name and state, please write in the chat your name and the state where you are coming, please. Okay, go ahead, Dr. Stewart, please.
Okay, and so the last part of this talk is going to dive a little bit deeper into semen collection. And again, I briefly talked about this before, but I was going to go a little bit more in depth into the things that we use to predict fertility. So remembering that we can collect using AV versus electroejaculation. So if you've got an animal that's trained to an AV because he's collected for semen freezing a lot, then that's an easy way to do it. But most veterinarians are going to use electroejaculation because you don't need access to a female or special equipment well, you do need special equipment, but not the same equipment as an AV. And so we do this to do our semen quality assessment, so which can vary a little bit based on species and breed, just like the testicular size. We'll see a lot more seasonal fluctuations, especially in our temperate breeds. We talked a lot about seasonality, especially when we talked about the physiology. So you guys should have that list. So when we evaluate the semen, we look at the color and consistency of the ejaculate, and then we go to the microscopic examination. And from there, we look at the mass motility versus progressive motility. We look for the presence of white blood cells, and then we usually stain the slide and dilute it out really good and look more in depth at the sperm morphology. And I might have shown these videos before, but this is kind of the difference between a really good, so this is a mass motility. We want to see this nice rapid swirling there versus this one over here, which you can see is kind of just somewhere between a slow swirl and no swirl, it's just movement. So it's somewhere between a fair and a good right here, whereas this one had the really rapid swirls. And so then we try to look at our progressive motility, which is the percent of sperm that are swimming in a straight line, because it doesn't matter if the sperm are swimming if they're all swimming in circles. And most of the time, because you can see with our ruminant semen how concentrated it is, we usually have to dilute it with a little bit of saline to assess. And so this is what that would look like with it diluted, is you can look a little bit more on an individual base. So it's more important than just mass motility. So looking at the mass motility, I always like as a quick scan, but it's antiquated and somewhat subjective. So so looking at a progressive motility gives you a lot more details because, like I said, we really need to know how many are swimming in a straight line. And so what technology do we have that can help us produce more accurate motility readings? And so some of this is special readers, and I talked about these a little bit in the last male talk, is ones that can give us that progressive motility, but give it objectively. But then they also can provide us with velocity parameters, which specifically tell us how fast the sperm is swimming. And so this is the iSperm, which connects itself to the iPad, and it gives you all those sperm velocity parameters, but it also gives you that progressive motility. And the thing is, we know what to do with progressive motility right now, but there's not a lot of data out on what any of these velocity parameters mean and what usefulness they can provide to our breeding soundness exam. So that's another part of a study that I've been working on, is trying to see if we can use more of this data in our breeding soundness exam. And so So I did have a summer student once that she was comparing that eye sperm to our benchtop CASAs, which is what we kind of consider the gold standard, because nobody's really done that with ram semen. So these were rams that we collected. And so basically, in our two most important ones, so the eye sperm one was the one that she did on the farm, and then she would extend the semen in extender, bring it back, and then she would run the second eye sperm in the CASA at about the same time. So to account for the fact that we might lose some motility in that time. And so this was the total and progressive motility she got initially on the eye sperm, and then, after probably like an hour or so, it might have been like an average of 2 hours that by the time she brought it back. And you could see that the total motility was about the same, but the progressive motility, which is what we were most interested in, dropped significantly. And then when we compared it to what is on the CASA, it's actually a much lower value than what's on the benchtop CASA. So what we were finding is that the eye sperm itself seems to be under calculating the progressive motility and saying it's lower than what it is if we're considering the CASA as our gold standard. And so actually the progressive motility might have been a little bit higher over here than what it was measuring. And that's also reflected in a lot of our velocity parameters. We saw a lot of decreases, especially with the curvilinear velocity here. And so these are just kind of what they're showing. So if this is the sperm's, basically if this is the sperm's path, we've got things like the curvilinear velocity, which is showing like how fast it's moving along a curved line versus a straight line. And then there's ones that look at like how its head is moving. So you've got amplitude ladder head displacement. So is it rocking from side to side a lot in that time period? And then linearity and straightness are similar. But those are used to help produce that progressive motility cutoff because they're basically showing how straight they are. So that's what all of these mean. And the nice thing about the eye sperm itself is that we can alter these parameters. So like the progressive motility cutoff. So that's one of the things I would like to do in the future is to alter some of these to see if we can get that progressive motility to match better to what the benchtop CASA is saying so that it can be a little bit more useful and accurate. And then she also did this when one of my colleagues went out to a RAM test station and we compared his subjective motility assessment to what the eye sperm was, and pretty decent correlation. So a perfect one would be 1, and the most unperfect one would be 0. So it's about halfway in between there. So when we're talking about total motility versus progressive motility. So it's just kind of an interesting thing to see, and that we can compare and show that, maybe we're getting a little bit more accurate measurements by doing an objective measurement rather than me just looking at it saying, I think it's 60% modal. And then since the start, that was a couple of years ago. So then last year there had been another portable sperm analyzer that came out from Minitube, and this one plugs into a computer. So we actually did a study last summer that compared this one to the eye sperm. And again, the eye sperm, when we looked at both of them in the field together, eye sperm seems to have a lower progressive motility. And then we saw, again, the same thing, a lower progressive motility of the eye sperm compared to the mobile CASA and the regular CASA. So, and we haven't altered any of the preset parameters. So pretty consistent results, but both of which seem like we've got to fill out some little kinks with them, but are possible things that we can use in the field now that they're available to improve our breeding soundness exams, especially if we can hone in on some of those important characteristics. And then morphology, which I would argue and I feel like I talked about this last time too, is the most important part of the exam, the sperm exam, because you can have absolutely perfect motility and they can still fail on morphology. And so when we are assessing morphology, we usually look at normal, and then our classifications go into head, midpiece, or tail defects, depending on where the actual defects are. So you can kind of see emphasize in some of these pictures. And so the normal sperm are going to have normal uniform shaped heads, a nice straight tail. Some of them might have little like kinks here just because they were swimming when they got stained. So, but as long as there's not like a big kink in there to see, this one was abnormal, so I crossed that one out, but the rest of these are all pretty normal. And so, like I said, there's been a lot of more bull studies than ram studies or buck studies, but the percentage normal sperm morphology is always the most influential factor. So, and we know from the bulls that sperm with abaxial tail attachment, so that's where the little mid piece actually like attaches off to the side, and those that have a distal droplet, so that's where the droplets down here, those actually are considered normal. And in the bull, we count those as part of our normal population in our spermiogram, and I do so in the rams too, just for based on all the studies that show that these sperm can still fertilize ova and produce viable embryos. And so by classifying all these defects, we can provide a lot of information on prognosis and guide our recommendations. So there's certain defects that will be associated with immaturity. So especially in those ram lambs that I go and do every year, I'll see quite a few that have a high number of these proximal droplets. So that's a pretty common peripubertal male defect. So it's usually due to abnormal spermiogenesis. And so if it's a young animal, I almost always defer classification and, recommend a recheck with a good prognosis. Um, and if you've got a ram of the same age that doesn't have these, by selecting that ram, you can actually start selecting for early maturing sires in your herd. So there is something to be said about selecting for the males that will reach puberty and have a passing semen quality earlier. So we've got some that have genetic links. So if we've got greater 20% of knobbed acrosomes, which is this over here, again, where you see this kind of thickened area where the acrosome is, a stump tail where there's just no tail, there's a little stump there. If you're seeing greater than 20 to 25% of those, and then detached heads, if we're seeing about 80 to 100% of those, it's either genetics or there's some type of disease in the testicles. Heat stress, scrotal insulation illness. So we talked a lot in the last one about the last lecture on body condition score. And so things that you can see when there's anything that affects thermoregulation are piriform heads. And this is a little nucleolar vacuolization right here. So piriform heads are just an abnormal shape, and that knobbed acrosome that I put over there. And this is showing this was a RAM study that showed kind of the effect of total in progressive motility when you have regular and after there's been regulate thermo insulation. So they put something around it to simulate that there was some heat stress on the testicles. And you can see significant declines in both of those, significant increase in major defects on sperm morphology. And I apologize, under the caption, it'll talk about DNA fragmentation is also increased when there's reversible. And the good thing about it is if the cause of it is identified, the ram's too fat, the bucket had illness, things like that, it's usually reversible. So you can see here, they did scrotal insulation from here. We saw the decline in progressive motility, and then after time, it started to improve and eventually made it back to where the control animals are. And same thing over here, where we were looking at the major defects. Again, we had insulation, we saw some major increases, and then they eventually, with time, went back down. So a lot of these can be reversible. And then just a couple of neat pictures is these are advanced semen assessment tools that are used mostly for sperm cryopreservation and research. But we're hoping to do a study where we can look at some of this and look at fixation methods so that we can do it on as part of a BSE for some of the trouble rams or bucks to get more intense data. So basically, you just put a fluorescent dye in with them, and if they're alive, they'll fluoresce green. If they're dead, they tend to fluoresce red based on the dyes that you put in because this is gonna stain all the ones that have a damaged membrane. And then you can actually see when they're kind of like in the process of dying because they'll fluoresce both. And it basically the computer will like pick up on all these dyes and then they'll put them into a different population of these are the number of sperm that were dead, dying, or alive, and tells you the viability. So similar, this one's looking at acrosome integrity. So again, the red one tells you when they're dead, and then this green one actually will attach to any damaged acrosomes. So it tells you when the sperm is dead with a damaged acrosome, when it's dead and has an intact acrosome, and if it doesn't fluoresce at all, that means it's live and it's got an intact acrosome. And same thing here, it goes through a computer, and the computer basically on how it's fluorescing these different colors will put it into these different populations and give you a readout on what the population with good intact acrosomes are. And then DNA integrity is another one that I find there's a lot more than what I'm talking about here. These are just a few example of ones that I've used. And so this is a what we call a metachromatic stain, so it'll stain a few different colors. So basically, we put the sperm into an acid solution to purposefully denature the DNA in it, and then you put the stain in, and the ones that are red means that they're damaged, and the ones that are green means that the DNA is intact. And so then again, it puts you into two populations here. Is either you've got damaged DNA or you've got intact DNA based on that. And this was from a deer study that I did, and this was when they were way outside of season and we could barely get sperm from them, versus this is when they were in the peak of season and this is when they were just coming into season. So you can see a varying amount of damaged DNA. And this is the one in most of our ruminants has had the most strong correlation with fertility. So I think this one has the most potential usefulness in our, at least in our selection of rams. Okay, I've got one more poll question.
Okay, I will go there. There you go. Easy one.
This one should hopefully be an easy one. You got a 50-50 chance.
Yeah.
All right. True or false, sperm motility is the only parameter assessed on semen, important parameter assessed on semen evaluation in rams and bucks, which is false because, as I mentioned, sperm morphology is also equally, if not more important than the motility itself. So while we spend a lot of time talking about motility, morphology is pretty important also. Okay, and so that's what I've got for you. So if I know anything about this group like I do, there's probably some questions waiting for me.
Yeah, so there are a few questions I will read out and then we'll go from there.
Okay.
So the first question is if bulk is banded, if the bulk is banded,
Mhm.
it cuts off doctor's difference and the sperm stored in the tail that will be cut off. So that will leave them sterile immediately. Is that right?
Technically, yes, but no. So if he's banded, yes, it's gonna basically cut off at the ductus deferens. There can still be some that are in kind of the pipeline, so in the ductus deferens itself. So I usually give it at least a couple weeks before you put them in with the females, just because those would be the ones that would suddenly find a way to survive in living within the ductus deferens.
Sure, thank you. So the next question is when collecting semen using electroejaculator, it's a little bit painful. So is there any way we can minimize the pain?
Yeah, so some people will use sedation for our small ruminants. Some people there's been a lot of talk about epidurals. Um and there's also been a lot of studies, and I actually had to have a conversation with our eye cook about this because um there were some study they were citing some studies that showed that certain factors were increased in a male that could have been associated with stress, and so they were asking us about that and us not using, appropriate pain control. But really, if you actually compared those same hormones to a male that just ejaculated, they were also elevated. And the ones that have looked at specific pain responses, such as substance P, did not differ significantly from normal ejaculation and electroejaculation. So while they may be making noises and kind of acting like painful, it may be more uncomfortable, but I've never had any. We actually did a study with bulls and found that each week when they knew they were going to be electroejaculated, they actually came into the chute faster. They didn't balk at trying to come into the chute, which is what we were expecting to happen if they were associating it with the negative, a negative thing. But that being said, if we do have animals that are particularly stressed by it, a lot of people will do some sedation, and there's no problem with doing that.
Sure. Thank you. So what is the best time frame to check the RAM for fertility?
Um, we usually like to do about a month before you're going to turn them out. Um, and some of that's going to depend on if you've got a replacement ready or not. If you don't have, or if you've got plenty of replacements, so if I had to fail one out of a group of 5 to 10, then you're probably okay with doing like the day before you turn them out. However, most of the time that's not the case. So most of the time you have to plan. So I usually say about a month before. You could do further than that, but there's a lot of dynamic changes that occur. So I think about that time is about the right period.
Sure. So there was one slide when where was kind of testicular size, shape, scrotal circumference in the different season. There is
Mhm.
one slide. So the question is, at what age these RAMs were measured? So what was the age when this research was done?
Right. So most of them started when they were about 6 months old and then ended when they were about like so the following year, so about, like 18 months old.
Sure. So the another question is, how cold is too cold for the buck or ram to be fertile, and how hot is too hot for them to be fertile?
Um, I don't know if there's any literature that gives you direct parameters like that. And some of it's, probably negative degree wind chills, probably too cold, but um, like as long as he can be comfortable and like with cold weather, if you've got him housed in a barn away from the wind and you've got it appropriately bedded, the risk on sperm production is going to be minimal. And then same thing with hot, most of the heat stress studies we know have been in dairy cows, but again, if you provide adequate shade, like there's fans or access to wind, things like that, then again, his testicles are going to thermoregulate himself to a degree. So that's why in the winter they tend to kind of hold him close to their body. In the summer they kind of let him a little bit looser. So unfortunately, I don't know any exact numbers for you, but for most situations that I would say are comfortable enough for a human, to be able to function in, even if we're bundled up or, providing a fan on ourselves, I think he can. If it's temperatures where you're not going outside because your fingers are going to freeze, then it's probably the same for him.
Sure. Thank you. Uh, so the next question is, I had four preemie lambs that are stillborn. Can this be genetic or possibly with other problems?
So, um, miscarries and stillbirths and abortions, you can get about 5% of that in any herd and it still be considered normal. Sometimes it's just a random bad luck of the genetic lottery, or if the female was stressed or had heat stress or anything like that, that could cause it. And if it's a one-off, I tend to think less of this, but there's always infectious diseases that could cause some of that stuff too. So if it was a one-off and nobody else is infected. I don't know if this is for preemie lambs from the same ewe or from different ones and how big the herd is, but if you've had four preemie lambs out of four females, I'd probably start looking for something infectious. But if it was four preemie lambs um, from two females in a 100 head flock, I probably wouldn't think too much of that.
Sure. So there are 4 or 5 questions at the end of the Zoom. Maybe you can read out if you have time.
Okay, yeah, I
But
see.
yeah, thank you.
Um, The hoof rat vaccine that's currently only approved for use via importation, but I haven't seen any animals given that because it's only approved for use via importation by the California wool growers, and I haven't seen I haven't seen any discussion about it on my small ruminant listserv. So and then the split at the bottom of scrotums, very little. So I've seen some that have very pronounced splits down there, and we have not found that those affect sperm quality. And sedation, heavy sedation, especially with something like xylazine, could cause urine to get into the sperm, but otherwise, there have been studies that found that most of them will not affect sperm motility itself. Correlation to offspring gender, male versus female. I'm not sure what you're actually looking for. I know there have been some studies with like looking at different like dietary additives, things like omega-3s versus omega-6s that can affect the offspring gender. But that's the only thing that I know of like that you could give the animal that might affect it. And I haven't seen anything that's like super definitive for that. Um, I don't, let me see. It looks like there's a few more at the bottom. Are there particular ranges from tests that will help me evaluate semen from a report given when buying fresh semen? Um, I would say looking at if the sperm morphology, looking at the percent normal and the percent of defects and looking at the motility. So, and if you go back to this, I can't remember if I put that information in the slides, but if you've got a vet that you work with, you can usually send some of that to them. And most of the time, if if they do BSEs routinely, they can tell you what's normal and what's abnormal on those. Okay, I think that, oh, yeah, to get more females born. Okay.
I believe that might be all.
Okay.
Yeah, there is a question. See, you have provide information on goat semen extender.
Most of mine I get commercially. I know IMV is where I get a lot of mine from. So, but there's a lot of, if look it up, there's a lot of different formulations out there that like people can use to kind of make up their own. But we just tend to use a commercial one for ourselves.
Okay. Uh, okay. I think was very interesting talk. So, how many talks do you give to us in this winter, Dr. Stewart? I think 7 or 6, 7.
Yeah, so somewhere around there.
See, yeah, yeah. Thank you so much. You went through the half of the certificate. So, and we are so thankful for all your expertise, and for sure the people will be contacting you, or we can ask some of the questions to you about it. So, we are going to have uh, several other talks. The next two, in February 2, we are going to be talking about artificial insemination with Dr. Yolanda Borton from Peterson Animal Hospital in Oklahoma. And in February 9, we are going to have Warren Staton also talking about embryo transfer and artificial insemination. I have received some emails from people to say, well, I will never be practicing any artificial insemination. So for those ones that they don't are interested in embryo transfer or in artificial inseminations, I will send you an email with some optional talks from last year. We have a very good talk from Dr. Maggie Highland about reproductive diseases, and also from Dr. Ken Coffey about balancing rations for nutrition in small ruminants. So we are going to send those as option if you don't want to see these that we have for February 2nd and February 9 about embryo transfer and artificial insemination in a small ruminant. You can go and to see those others. Now you want to see all of them. You are very happy for you to participate in that way. So We thank you so much, and we are going to send information to everybody. So thank you, Dr. Stewart, again.
Thank you.
Thank you, Dr. Stewart.